Hi, my name is Jerry Obed. I'm a dermatologist here practicing in Fort Lauderdale, Florida. And what we're going to discuss today is the OmniMax by SharpLight Technologies. I've had it now for almost a year and I've had really great results with it to date. The main reason that we selected this laser, the OmniMax, was for its versatility. It was the second laser that we actually purchased here in our practice, which is probably about 80% medical and 20% cosmetic. Our first laser was a tattoo device, which has done really well, but as our practice has expanded, we wanted something that could help more on the aesthetic side for cosmetic purposes. Most of our patients now that we're seeing for this reason come in with complaints of just looking tired, aged skin, just want a refreshed look of some sort. A lot of times there's obviously lots of concerns regarding pigmentation, vessels, and wrinkles, and this device is able to treat all of those. In addition, even though I didn't purchase it for that reason, it's done a really great job with hair removal, as well as some skin tightening that we're going to discuss in a little bit. The 2940 wavelength of this device has done a really great job for us for a couple of reasons, and this specifically being for the resurfacing, the skin tightening, and so forth. The main reason that we like it is that it's very well tolerated. There is, I tell everyone, about 3 to 7 days of healing, but there's really no reason someone can't go back to work that day and the following day without really any difficulty. The other nice thing about the device is that it turns on really quickly. There's almost no downtime whatsoever with it heating up. Even if you're using the cooling handpiece, it takes approximately 60 seconds for that to occur. So even if you're changing handpieces, if you're switching to different devices, you have basically a minute at most to do so. So it's very quick and easy. The patients aren't waiting. The staff isn't really burdened by that, and things go pretty smoothly once you get started. The main focus, again, as we say, is that we can do, it's certainly not as aggressive as doing a fully ablative CO2 laser, but along with that, of course, you see lots of downtime, lots of pain, lots of scarring potential, lots of even chances of infection, and we don't see any of that with this device. So very straightforward, very user-friendly, and also very, I guess patient-friendly, if you will, because of the minimal to no downtime, minimal to no discomfort, the ease of use of this device. It rolls readily, it's easy to move between rooms, and I think it's just like the right size. It's just big enough so that, obviously it looks substantial and it has like that curb appeal, but it also does a really great job as far as being mobile and being really quick to turn on and to switch handpieces and do multiple treatments at one time. So living in South Florida here, there's lots of obviously photo damage that we see, specifically related to sunspots, fine vessels, and then of course premature aging. One of the handpieces that the device has is able to treat 2 of those, of course the browns and the reds. So the fine telangiectatic vessels that we see on the face, the broken capillaries, even disease states such as rosacea, all are treated very readily with this device. Now, essentially every patient that we see with those types of problems also has brown spots, the solar lentigos, the age spots, the liver spots, what have you. And those also are very receptive with the device due to what they call that photothermolysis. So basically the laser has its target, chromophore, whether it be the hemoglobin in the blood vessels, the pigmented lesions, or even in the resurfacing, the water that the laser targets actually uses to heat up or modify so that the body's able to clear them and yield a much improved skin texture, skin tone, skin color, and so forth. And the laser does a really great job in minimal treatments to accomplish that. Regarding pain and discomfort, again, very minimal. Patients tolerate the procedure well. Makeup can, of course, be applied. Sunscreen can be applied. Again, we're not creating any bleeding. Regarding my decision to purchase this device specifically, I was fortunate to be able to demo multiple devices and spent a lot of time with many doctors in the area, locally, but also internationally. And it was, a combination of things. It was the versatility of the device. Obviously, cost plays a role, but I think that the company was very attractively pricing these devices. And again, the results that I saw. Prior to having this device, I had days where I had demoed multiple devices in my office, but I felt like this device did a better job. So it was a really easy decision for me when it came to it, when I was done with the demo. And I had the need, when I had developed enough of a cosmetic base of patients to be able to purchase a device such as this.